Hi, I'm Degé Coutee with Patient Advocacy Network at cannabisSavesLives.org, and this is your week's episode of the Compassion Flower Report, where I bring you news and information about medical cannabis around the world. And we're going to start with a couple stories that are international. This one comes from a blog called Medical Express. And headline here is Lithuania Parliament votes to legalize medicinal cannabis use. It says Lithuania's parliament on Thursday passed a law that will allow doctors to prescribe marijuana-based medicine in the Baltic EU state. I have a feeling this is going to sound a lot like what they're doing in the UK. It says lawmakers voted 90-0 with 3 abstentions in favor of the legalization that will now go to the president to be signed into law. Other European countries that have legalized cannabis for medical purposes include Austria, Britain, Croatia, Finland, France, Germany, Greece, and Italy among them. We've got shaking because there is a cat that has decided that he needs to bathe on my desk. The law will come into force in May next year. Selling the drugs will require a license from the state regulator. Recreational use of marijuana remains illegal in Lithuania, a Baltic state of 2.3 million people. So, again, it looks like the way it's being phrased, and again, the phraseology with medical marijuana is sometimes tricky when you're talking about a prescription versus doctor recommended, and whether or not Lithuania is going the route of maybe something like a pure cannabis oil, maybe more heavily CBD than THC. But we'll see. But it's good. It becomes harder to discredit medical cannabis and ignore its value when more and more countries get on board. This comes from a website called In Your Area. Medical cannabis will soon be available on prescription in the UK, but who will get it? Some of the interesting, there's some anecdotal, just kind of some patient information here. It says, while cannabis will not be completely legalized, doctors will be able to prescribe cannabis as an oil for treatment as of Thursday, November 1st. Although mostly associated with smoking properties and the ability to get high, this new brand of treatment will focus solely on the plant's medicinal properties. The move follows a high-profile case involving Charlotte Caldwell and her son Billy, who had a 6-month worth supply of cannabis oil seized at Heathrow Airport when returning from Canada. Billy, who has autism and severe epilepsy, uses cannabis oil to treat his illness, was the first to be given a prescription for the life-altering medication, leading to a change in precedent in the Home Office. To a layman, cannabis oil is a thick, sticky substance extracted from the leaves and flowers of the hemp plant. The substance is ingested but does not leave the user with a sense of being high. Instead, it is believed to offer a sense of relaxation without impairing a person's mental state. So they go into talking about CBD, and that THC has to be under 0.05%. They get into what the cost of the treatment is now, and it says that the cost will change when it's available, but it doesn't say when, it doesn't say why it will change, if it will go up or down. And it says that it will be available for patients with cancer, AIDS, epilepsy, chronic pain, and MS. So that's where they're headed in the UK. It's going to be available, again, they're saying by prescription starting November 1st. The big question of this article was who will be able to get it. And like I said, they're going to they're going to allow patients with cancer, AIDS, epilepsy, chronic pain, and multiple sclerosis. It does mention that the treatment, currently the treatment retails between 19.99 and 59.99 pounds. But it says which will dramatically change when the oil is available on prescription. And I don't know if that means it's going to change up or down. But again, we're following this in the UK. It's really big that the UK is moving forward with medical cannabis treatment. This comes from Bloomberg Newsweek. I've got one very restless kitty right now. Um, Bloomberg Newsweek. It says, forget stoners. The real money is in medical marijuana. Um, I don't want to forget stoners. I've got a lot of wonderful stoner friends and I love them. It's interesting that they're saying that the real money is in medical marijuana, but they mean it in the real true sense of the word. And this could be really good, but it could be, I guess you could say, dangerous, or in that when things become heavily pharmaceuticalized, especially in the United States, it becomes less and less in the hands of the people. And I would just, pharmaceutical companies want to come up with wonderful cannabis-based medicines. That's wonderful. But I don't want that to prevent patients from growing their own and making their own tinctures or oils for themselves if they want to do that as well. I want as many cannabis-related options as possible, not fewer. So if this adds to that and doesn't detract from other, then that's wonderful. More doctors are warming up to marijuana's medical benefits, and companies are angling for a piece of a market that could reach $50 billion by 2025. So this is saying that the real money is in medical marijuana. 3 years ago, Dr. Lydia Hatcher had a straightforward answer when chronic pain patients came to her clinic in Hamilton, Ontario, asking for marijuana. No. Since then, whispers and research in the medical community about what the drug can do have sparked a change of heart. She's now prescribing pot and seeing the benefits in patients who have exhausted other options. One wheelchair-bound 97-year-old woman was able to get up and dance after receiving treatment for arthritis. When you see results like that, it makes you feel there's something more to this, Hatcher says, noting that more than 10% of her patients use only cannabis to treat their pain and related symptoms. All the focus this month is on Canada legalizing recreational use, but the real money could be made in medicine. More than 20 countries, including Germany, Mexico, and Australia, have approved the use of medical marijuana. Denmark and Luxembourg have taken steps to legalize the drug for medical use. The UK plans to allow prescriptions for cannabis-derived medicines by fall, and investors expect many more to follow. Medical marijuana sales are expected to dip in Canada when recreational becomes legal, but significant growth is expected in markets where medical marijuana programs are emerging, according to a report from ArcView Market Research and DB Analytics. We've covered the ArcView Market Research and DBS Analytics on this show before, and also that dip that they talked about, that has been covered in other reports as well, that when recreational comes into effect, there's a dip in medical, and then it comes back. And like I said, I think some of that is there's a part of the cannabis community that decides they won't renew their recommendation and they'll just become a recreational user, even though they're using it therapeutically. For statistical purposes, they're going to look like a recreational user. And then medical users tend to stock up before any legal changes, which means they might not need to go into a retailer for a couple, 3 months after the laws change. So then after that, like I said, that little dip comes back and medical marijuana starts to even out back where it was. It says the global medical pot market could be worth more than 50 billion by 2025 from 8 billion in 2017, 10 times the projected size of cannabis total marijuana sector, according to PI Financial Corp. Medical is potentially bigger for sure as percentage growth, says Bruce Litton, Chief Executive Officer of Canopy Growth Corp. There are signs pharmaceutical companies are already coming on board. In June the U.S. Food and Drug Administration approved GW Pharmaceuticals, Epidiolex, I believe that is Pediolex, to treat two rare forms of childhood epilepsy. It was the first medical marijuana treatment derived from marijuana plant to get the green light for sale in the U.S. British Columbia-based producer Tilray Inc. has already agreed to develop products and deliver systems with Sandoz, the Canadian division of Novartis International. There's a lot of mouthful of pharmaceutical companies working together that they're already talking about making cannabis-based medicines. Several companies are also actively seeking better ways to deliver medical cannabis that mimic traditional pharmaceuticals and offer more precise dosing, including soft gels and nasal sprays, says George Scorsa, CEO of Liberty Health Sciences, Inc. The biggest opportunity for medical marijuana could be in pain treatment. Scorsa says the opioid crisis in the United States has physicians and patients seeking alternatives. So that's the other part of this that I'm seeing, and I had anticipated for a while, is that as the population gets older and we see our baby boomers get older, they are going to become more and more likely to try cannabis as it becomes more acceptable and readily available. And also, I think they're just going to be ready for alternatives, and they may already have side effects and symptoms or issues with other medications that they're fed up with, and they become much more likely candidates to try cannabis for pain. So I think we're going to see a lot more of that. And then this story comes from the Growth Op. It says the future is bright for medical cannabis. Patients and healthcare practitioners are often overwhelmed by the wide variety of cannabis strains available to them with no idea where to begin. It's easy to get confused or even intimidated when one comes across strains such as Purple Haze or an OG Kush. So this story talks about what I find fun is that there's going to be not just this there's legalization and all of that opportunity, but in the medical realm, all of the genetic opportunities. They get into talking not just about CBD, but they start to talk about CBN and CBC and just all the opportunities for genetics. And it says, that it's the hope is to produce more effective medicines for the patients looking for solutions to their conditions. So this article goes into very optimistically, I find this part interesting. It says, as the medical cannabis industry separates itself from the recreational cannabis industry, patients are only seeing the beginning of what cannabis and its complex genetics can offer. So it says, as cannabis has matured over 6,000 years, the genotype or code that determines the plant's appearance and therapeutic properties has been pushed and pulled by centuries of cultivation. Many black market breeders have been pushing the plant to produce as much THC as possible, the psychoactive component that produces the famous high tied to the cannabis plant. But with further research, the full potential of the plant will soon be unraveled. says this data will enable us to better understand the effects of various cannabinoids and terpenes, their synergistic effect, and how their impact links to the individual's genetics and biomarkers. This data is key to understanding the most effective combinations and strengths for various conditions, moving towards targeted, personalized medicines. I've had friends that have been working on this for a very long time and figuring out what strains to blend together and in what amounts to have the best effect for whatever patient they're trying to treat. And because cannabis is safe and effective, um, many patients who are dealing with Crohn's disease or neuropathy or treating cancer are willing to try oils that have been made with different levels of THC to CBD, etc., to um, see how it works, see what's most effective, and be those guinea pigs, basically. And like I said, it's a positive thing because either it's it's not going to be as effective, or it's going to be incredibly effective for those patients. And there just aren't going to be any negative side effects to decide choosing to go ahead and be experimented on with different oils and tinctures and capsules, and see what works best. So I think all the news this week about medical cannabis was very positive and very exciting. But again, it's very much leaning toward marijuana being on the bright side because of the potentials in the pharmaceutical market, which I do think is exciting. Like I said, I still want to see patients be able to grow and make their own. That's fine. You can't, if you can't sell what you make from home or whatever, but um, we still want our mom and pop boutiques, and we still want patients to be able to grow their own cannabis and um, make their own medicines at home if that's what they choose to do, and not have the pharmaceutical companies rip that away. And that is the balance when we're talking about rescheduling versus descheduling. And when you go from schedule 1 to 2 and 3, that puts it in the realm of being controlled by the pharmaceutical industry. And not that I'm against the pharmaceutical industry. Again, I just don't want it to have to be in sole control of the pharmaceutical industry. We can, like I said, we can live in a world where there are really effective cannabis medicines that are made by the pharmaceutical industries, and we can have our nutraceutical cannabis that's good for the human endocannabinoid system, and people should still be able to be able to do it at home. It really falls into cannabis being treated, and I'm sure you've probably heard this before, but being treated kind of like beer and wine. That you can make your own beer at home, and you can have your friends over and even serve them the beer that you make. And I think you can even maybe even send them home with a little bit. Can't even really do that with cannabis. We have microbreweries, we have vineyards, we have tasting rooms, and then of course we've got the much larger distribution of things like beer and wine as well. And it's still, alcohol is still very well monitored by the federal government. You have to have a liquor license. But I think in many ways, cannabis can be treated like a pharmaceutical, like a nutraceutical, like herbal supplement, as well as a recreational substance. It's just want to have the best of everything with it. So while I'm reading all of these articles about how excited it appears the um, the pharmaceutical industry now has become about medical cannabis. I just don't want to see it disappear for patients individually at home and in those mom and pop boutiques that do a really good job of taking care of patients. This next story is not um, new in in the larger sense, but apparently this is kind of a new story for Maryland, but it's a federal story overall. This is guns and medical marijuana, an illegal mix according to feds. This comes from a Fox affiliate out of Baltimore. It says Maryland's medical marijuana users may have gained the right to use the drug, but as a result, their right to bear arms is taken away. It says buying a handgun in Maryland requires a visit to the state police website, log on and answer a list of questions about criminal history and possible alcoholism. When one reaches a question added last year, are you a legal user of cannabis, marijuana for medical purposes, or are you issued a valid medical cannabis identification card or valid medical cannabis identification number or identification card? Answer yes and join the 23 other applicants blocked from buying a handgun in Maryland because of medical marijuana. Mark Pennack, a former Department of Justice attorney and president of Maryland, shall issue uh, when he talks to gun owner who finds they are stunned to learn that they must choose between their guns and medical marijuana. Their attitude is, I need this. The doctor says I need this. It helps me. And you're telling me I have to give up my guns or can't buy another gun? Pennock says. That's because medical marijuana is illegal under federal law, and the Gun Control Act of 1968 says one cannot buy or continue to possess guns while using marijuana. That's because medical marijuana is illegal under federal law, and the Gun Control Act of 1968 says one cannot buy or continue to possess guns while using marijuana. Drug counselor Mike Gimbel supports the restrictions, citing marijuana's effect on decision making and motor skills. Oh, I don't think people who use medical cannabis are looking to shoot somebody. Anyone who's ever gotten stoned, think about, do you really feel we're able to handle a gun? I don't think so, Gimbel says. What a loser Gimbel is. Pennock, the former Department of Justice, says only an act of Congress will allow for gun ownership while using medical marijuana. That's the most important sentence of that story. Only an act of Congress. So again, yet a need for another bill. We've got bills that protect states that have marijuana laws. We've got bills that are trying to deal with banking, uh, bills of strengthening state rights, bills that deal with taxes, and now we are gonna have, and then that's a hot button issue, right? I mean, gun. We're living in an era where there's more gun control or desire for gun control more than ever. At least that's what we see in the media. And then you're going to have a group of people, medical marijuana patients, who are saying, we want to be able to have our guns. It's also very dangerous because, by singling out a group of people like that, by saying medical people involved with cannabis in general, whether it's medical cannabis or now adult recreational, none of these people can have guns. So now think of all these people that are involved in the industry in one way, shape, or form. You're basically letting every criminal know that technically those people aren't capable of defending their homes or protecting their families because they're not supposed to anyway have a gun at home. So I think it's really dangerous, especially now that we're moving toward more and more legalization and more states having medical, that if we really are a country about our Second Amendment rights and being able to protect our home and protect our families, and seeing people involved with cannabis be singled out just because of their involvement or their use of cannabis. I'm not buying this whole judgment and dexterity or whatever, decision making and motor skills. Like this, it's not like people get high and then decide they want to take their gun out and play with it. Gimbel's got his own issues. What is Gimbel again? He gets under my skin. Drug counselor. Yeah. Well, I think he's got some. I could think he could go use his own counseling. So again, those are the stories. Just some real quick headlines that are going on around the country. I think again, the headlines say a lot. These endometrius sufferers rely on medical cannabis, but legalization hasn't made access any easier. These are people in a couple different states. Again, like I've said, I make sure these headlines are available other places. So if you're interested in finding these, you'll find them on our other social media. Louisiana says medical marijuana plants are ready for harvest, but lack of testing lab could lead to delays. We're seeing this other places where testing is mandatory and there's a shortage of labs. There's a backlog. Coast Mayor backs Mississippi's medical marijuana campaign, hosts event. North Dakota update patient applications for medical marijuana are going to be available there in October 29th. Again, that's North Dakota. Poll, this is about Utah. Utah just had a vote on the floor about medical marijuana there, and as a result of that, it says support for Utah's medical marijuana ballot initiative dips to 51% 3 weeks before Election Day. Fifth lawsuit filed over local medical marijuana ordinances. How are cities across Oklahoma regulating businesses and patients? So those are some of the things going on around the United States as we lead up to the midterm election. And again, I thank you for watching and getting involved, and I thank those of you who support what we're doing. All these stories and more are available for you on our Twitter at Pan for Compassion. I always make sure that link is there for you below. If you sign up for email updates at cannabissaveslives.org, I will send you action alerts and a link to our blog when we post all of these headlines for the month. Please donate. Patient Advocacy Network is a charitable 501c3 organization. Your support is always tax deductible. Visit our website at Cannabis Saves Lives and click the donate button. You can very easily become a monthly sponsor there. Any amount that is right for you. Please like, subscribe, and share this video. And until next week, I'm Degé Coutee, and this has been the Compassion Flower Report.